The Congenital Heart Center at Helen DeVos Children's Hospital has grown tremendously in the past 4 years, offering new expertise to children and adults with congenital heart disease. And today we're talking with Dr. Marcus Ha about their further expansion. Welcome to 8 West.
Thank you.
Yeah, so first off, a congratulations is in order on your new expansion.
Thank you so much. We were very excited about moving in.
Yeah, so let's talk about how you have grown over the last 4 years, because it's really remarkable.
Well, the story really began sort of in 2012, and we, at that stage, were only performing about 7 major surgeries and 50 minor surgeries a year in cardiac surgery for children. And our concept was to bring childhood to old age care for people with congenital heart disease, and now we're performing up to almost 300 procedures a year. So you can understand that's a massive, complete, utter change. And in addition to the surgeries, we're doing maybe 500, we've done about 500 cardiac catheterizations and a couple of hundred electrophysiological procedures. So what that means is we've got a load of people coming in the clinic that never came before, and our space is so cramped that people were having to cross each other, bump into each other. The noise was amazing, and so we're incredibly excited about the new space.
Yeah, so the need is obviously great here in West Michigan for this type of specialized care. Yep. So really you have outgrown your previous space.
Correct, yeah. And also the new space is going to be very exciting because it's really purpose-built and designed for heart patients.
So let's talk about this expansion. What are some of the changes that people can see when they walk into the new location?
Well, obviously the first thing is the size. It's a very large space. It's about 12,000 square feet. Wow. And then in addition to that, the design is that there are 4 pods of exam rooms, echocardiography rooms, which is a specialist investigation, and workspaces for nurses, so that we can have patients traveling through the department without having to cross over each other or walk through the clinician's workspace. And so that's going to be a much better experience for patients, for children and for adults.
Yeah, we're seeing on the screen right here some of the new clinic features, and the list is really long. The waiting room has expanded. Your echocardiogram rooms, you now have 8, like you just said, and it seems like this is going to be a much greater workspace for your staff, which means that you're going to be able to give specialized care and even better care to patients that are coming in.
Absolutely right. In addition to obvious additions like the extra echo rooms will mean that patients don't have to wait between meeting the physician and having an echocardiogram, which can be a real dissatisfier. If you're in for a 2-hour slot for an echo and an exam, and if there's a 50-minute wait between those two, then it's a long, long time to spend. So we'll be much more efficient, and that's great for patients. But in addition to that, we've got we're really, really pleased. We have a full exercise testing with metabolic lab in the space, which means as we go along, we'll be able to develop exercise programs for patients who are a little older so that they can be maintained in health. And this is something in congenital heart disease that hasn't really been explored, or we haven't really taken advantage of the benefits that the prescribed exercise can be for adult patients.
Yeah, when we're talking about the need, it is great. So we have a sheet that we'd like to show our viewers with the statistics on there of why these changes have been made. So why don't you start off by talking to us about what we're seeing on the screen?
Well, obviously, the main treatment we have for congenital heart disease is cardiac surgery and cardiac intervention. Intervention is where you do a surgery with a catheter in a cath lab, which doesn't need an open operation, which is great for patients, but not all things can be done like that. So we have a large number of patients who we're treating in the clinic, and basically the outcomes have been spectacular. So we now, for the last 3 years, we have a 99% survival rate for our interventions, which is as good as it gets anywhere in the world. But these patients are going to grow up and they need lifelong care. So the clinic is their medical home where they're going to access all the advice that they need through transitioning from teenage to adult life, where women can have advice about contraception, childbirth. Their pregnancies can be monitored in the Congenital Heart Center so that they can have safe pregnancies. This is really about delivering quality of life as well as just survival.
Yeah, well, we are very excited for you and everyone who specializes in this care. The move happens on Monday,
Yep.
which is right around the corner. So how can viewers get a hold of you if they're looking to get this type of care?
Well, obviously they can contact us at helendevoschildrens.org and look at the Congenital/Heart Center, or they can phone us on the number on the screen. However, we're very excited about the move, and I think it's quite fun that it's on the 31st, because we're hoping it's not going to be a horror show. We have to pack all our electronics and gear up and move it across to the new space, and we're open for business on the 1st of November.
Great. Marcus, congratulations. Thank you so much for bringing this care to our West Michigan
Thanks for
viewers.
having us.
Yeah. All right, don't go away. We'll be right back.